Welcome back, Cannabis Life Radio. I'm Nasser El Mula, alongside Arby Barroso, Cheryl Murray Powell, our in-studio guest, David Kotler, and joining us to educate you how to talk to your healthcare provider, your doctor, about using cannabis. We have Dr. Uma, and if you don't know Dr. Uma, she is a specialist in the cannabis therapeutic space, and she has been educating the public about cannabis and the endocannabinoid system from all ages, from 18 to 100. And we actually have Dr. Uma. She's calling us live from Jamaica. Dr. Uma, can you hear us?
Oh, that's why she was saying that she didn't know if she could join us.
Thank you for having me here on Cannabis Live Radio.
Oh, we're glad to have you, Dr. Uma. You know, we have a love affair with you and your approach to cannabis, and we can't get enough of you. Thank you for making yourself available while you're in Jamaica. I'm going through Jamaica withdrawals. I haven't been back in about 3 weeks.
There in a bit.
About 3 weeks, so that's too much for me. So I'll be there probably right after you leave. But thank you so much for what you do. We even spoke about you earlier. Every time we talk about cannabis being an exit drug, we're sure to reference that you were the first person that we heard to really refer to it as cannabis being an exit drug. So thank you for joining us today. I know you wanted to talk about educating patients and helping patients have those discussions with their physicians. What's the first step for a patient who thinks that cannabis might be helpful in their treatment?
Well, you've just hit it on the head. The first thing is the patient first even thinking about it. And one of the biggest barriers in my mission is that we want to change the stigma related to cannabis and for everybody to know that there is an endocannabinoid system. And one of the basic things is that us clinicians were not taught this, and even now we are, I think 15% of the medical schools or healthcare providers are even being educated about it. So the first discussion is understanding that this is about harm reduction, and cannabis should be a first-line option and not the last resort, is what I truly believe. And the steps that are happening is that there are states that are now having medical marijuana programs and, again, destigmatizing it and making it available. And the procedures differ from state to state. So once they understand that they are eligible based on the state criteria, trying to find a healthcare provider that they can speak with to get certified is parts of this step. And I am here in Jamaica, St. Anne at Kaya, and today is the first recommendation that is being written here in Jamaica, and this is a momentous event here. And so we are making the changes, and this is a global issue. I want people to understand that all of us have an endocannabinoid system, and cannabis works with this beautiful system. And I truly believe it's not for everyone, but it should be a first-line option. And as you've mentioned, I have been using cannabis for my patients, and I've been clearly stating this is a exit drug. And I clearly say the word exit, meaning patients are getting off their medications and even being able to lower their oxys, their narcotics, their prescription medications, even alcohol. And I'm adding nicotine to my statement because we are seeing patients getting impacted by this in so many different ways.
I want to just take a couple steps back. You mentioned that you're at Kaya, but I don't think our audience really grasps the magnitude of what's happening today in Jamaica. So you're at Kaya Herb House, which is the first legal dispensary opening in the country of Jamaica. Mr. Vaswani, congratulations for that victory. Yes. This is huge for the whole island. It's huge for the whole Caribbean. So pretty much in the entire Caribbean, this would be, besides the U.S. Areas such as Puerto Rico, I would think, this is the first time that there's been a legal dispensary for cannabis. So what is it like there? What's going on for the celebrations?
So the celebration is happening right now. We are having the opening event, and they're actually calling me right now. But we are having I'm going to send you guys some pictures, and we'll
Please.
send some
Yeah,
clips to you guys
definitely send
so
them.
we can post it on the website. We'll make sure.
And tell.
But we're a company.
No, I was going to say tell Kimani Marley that he needs to be on our show because he's supposed to be performing today or present today.
Absolutely. There's also people from, we've got people from Nature's Roots. Danny Fontaine is here. We've got other people here. And we've got Juice, and they're ready to call me. But I will give you guys an update later on today, and we'll send some pictures. But sending you lots of love and blessings. And remember, reach 1, teach 10. And
Yes.
cannabis is the exit drug. And remember, hydrate before you medicate. Start out low and slow with food. And remember to journal.
Love it.
That's right.
And our website is totalhealthcarethc.com.
Love it.
Educate,
That's
empower,
it. God bless.
embrace,
Thank you
educate,
so much.
empower.
Bye, Uma.
Bye, Dr.
All right.
Uma.
Dr. Uma,
Yes,
thank you
educate
so
and
much
break
for
them down.
joining us.
God bless, guys. Thank you so much. We'll send you some pictures.
She's a little
Thank
busy.
you again.
Yeah. Please send pictures.
Listen, we
She-
got her.
And
We
she's
got
in
her, though.
Jamaica.
We
Yes.
got
And she's in
her.
Jamaica.
Listen, we got her for a couple
You're lucky
seconds
we got
there.
her, and she's in Jamaica.
She, yes, I'm very jealous, but I'm glad she's there representing
Cheryl's
for
like,
us.
I'm catching the next flight.
Oh
I'm
my
out.
God! Like, what time is it leaving Miami? Judah, we're going to.
And Dr. Uma, correct me. Didn't she win an award at the Cannabis
did.
Business Awards this
She
past year?
did.
What award?
I think it was
does
the best educator. I believe she was for best education. She won the award, but we can confirm that. But yes, at the Cannabis Business Awards, she did win the award. Well deserved. She's based in Massachusetts. Her practice is pretty much transitioned from pharmaceuticals, prescriptions to a cannabis-based
regimen, basically.
for
It's a
their-
regimen.
Absolutely. So congratulations to her for doing that and all the lives that she has saved in doing that. She brings up a really good point about that first conversation with your physician. As we're traveling and we talk to patients, it's very tricky. It's very very difficult for patients.
It's a maze. It's a maze because you don't know the person that you're facing is going to accept that. And
Yeah.
the doctors are typically, a lot of them, or the old school doctors, are not very acceptance to that. We noticed that at United Stands when we
Sure.
went to Nova. They're
Yeah.
not very acceptance. We don't have to write or recommend cannabis. I could write opiates or oxys all day long if I want to.
Yep.
I don't have to write cannabis
Yep.
or recommend cannabis or go through the time to educate myself on cannabis. But given these drugs, it's just so simple and detrimental across the board. They don't realize from 19 to 28 years old is the biggest opiate epidemic right now. We lose
Yep.
about 100 people every day. Then let's not talk about heroin and everything else that's been brought back due to this pill, including when in Florida when they say you can't smoke medicine. I'm not going to advocate. This is absolutely horrible to do, but the fact is that you could smoke these pills, and you could shoot these pills, and that's why heroin's come back, and you could snort these pills and do everything you want with these opiates, but yet you can't go to your doctor and say, listen, I'd rather not do this. What do you think I could do in reference to the cannabis side?
People are nervous. They're nervous to tell their doctor.
They shouldn't be,
They go to
though.
their
That's
doctor
the-
and they
that's-
ask that one
that's the
question
fear.
in the checkbox: do you smoke? Do you not smoke? And usually people don't check
I
it
got
off.
asked that for my life insurance policy, and I actually had a conversation with them yesterday. I'm like, you're asking me if I smoke cannabis,
Right.
but you're not asking me if I've taken all these other drugs, which I have, and I have no shame in saying that. That's why I'm here today. They wouldn't ask me, hey, what other prescriptions were you on?
Yeah.
Right.
Do you smoke cannabis?
And I have a friend who actually specifically sells life insurance for cannabis users because they do get denied sometimes.
They
So-
asked me that question.
Yeah.
I got lit yesterday.
Yeah.
I was like, why are you not asking me about everything else I could be on?
Right.
Why are you asking me about cannabis?
Exactly.
I think Dr. Uma's initiative is that these doctors, they are the most trusted people. When you and like we've had other guests on the show before. Thomas Trench came on to our show. His
Yes.
doctor told him, here's the medicines you should be taking, and then his outcome was something that he didn't want. He
Right.
wasn't relieved from
He
the medications
wasn't leaving
he was
his
taking.
house.
And so the problem right now is, I think
See, that's a problem.
Crazy.
Dr.
Yeah.
Uma's initiative is, doctors are the most trusted people.
They
They're the
are.
people that you go to for answers. So you've got to, be comfortable telling your doctor that you are considering it or that you've looked into it, number one.
Right.
But number two is the doctors themselves. Dr. Uma, I think her big initiative is that they're educated about the endocannabinoid system. That's my
That's
big
huge.
struggle is that these, there's this system out there that not a lot of people understand,
Naturally occurring
including
system.
doctors
I'll-
who have to have so much schooling to even become a doctor.
I'll give you an example. I connected with one of my sorority sisters this week. We haven't seen each other in a while, and I see her walking towards me, and she's walking with a cane. And I'm like, what's going on? Like, we're same age, went to college together and everything. And she said, well, now I'm on cannabis because I tried everything else and my doctor recommended it, and nothing was working. But then when she went to another physician, because of course a gynecologist, whatever, they were like, oh, well, that's drugs and that you shouldn't be on that, So there's like, you as a person, you have multiple doctors for different things, especially as a woman. You have multiple doctors for different things. And then one's giving you one bit of advice as far as like, again, it wasn't the first resort, which it should have been, but even as a last resort offering cannabis, and then you go to another doctor and then they're going to treat you like an addict, or you get put in the hospital, they're going to treat you like an addict.
Or if you have a child and you show up with your child, they could call, department.
DCF.
Yeah, DCF.
Absolutely.
I mean, that's the problem is people that are sick are not seeing one doctor. So they're going through their family
physician
practice,
that they've been
their
trusted
physician,
for probably
their
years.
so on and so on and so on. And one of those people in that chain is going to be like, what are you doing? You can't be doing this. This is cannabis. This is a drug. So they're not all going to be on the same page. This is what we need to start, and this is what has to break that. They have a software system. They should be all talking to each other. Well, you know what? We've had them on all these drugs. Now we're trying to recommend this. Are you guys all on board with this? Because we don't want this patient to be taken off or, God forbid, have a problem with their insurance, with their children, with anything. It is a big problem, and it's people don't want to be in the system either. You don't want to be in a software system. Now all of a sudden for the next 10, 20, 30 years, you go in there and you have a system that says, yeah, you're a smoker or you take medical cannabis. What did you have? I mean, this is, I think it's crossing the line, and I think the doctors are the defense of this, and I think the young doctors are getting on board.
They are.
I really do. We talk to a lot of them, and a lot of them are getting on board on what we're doing. I think it's the older generation that are kind of stuck in their ways.
And to your point, even the nurses and nurse practitioners are on board, but they can't recommend.
No.
So
we have a lot of, we have a revolving door in our facility. I mean, we've had doctors, police officers, firefighters, canine dogs, attorneys, RNs, LPNs, any type of profession. We have them in,
sponsors list.
And we're exactly in our sponsors list.
Yeah.
So we understand them. We talk to them and they're like, listen, we don't want to go against the doctors. We can't lose our jobs. We can't recommend this. It's working for me, but we don't talk about it.
My thing in any of these professions, if I have a customer or I have a client or I have a patient, no matter the person, if they are considering something, one, they've got to be willing to share that they want to try something, right? So as patients, we've got to be willing to share with whoever it is that we're interested in trying cannabis. And as my physician, I want them to look at every option and to see if that is actual possibility.
It should be a start.
If I'm telling my doctor, hey, I've been looking into cannabis, I'm thinking about taking it, I want my doctor to never say no. I want to know that my doctor went extreme lengths to figure it out and see if it's actually worth it, and they don't, and that's the problem.
That's the problem. They don't get educated enough in the system or learn about it. I was at a doctor's office about a week and a half ago before we started doing all this traveling, and I took a friend of mine that's addicted to Roxy's, and I wanted to get him off. So I think Cheryl was there. I said, get in my car. We're going to go see a friend of mine. Took him to this facility, talked to the doctor. He's God bless, right now he's doing well. But I asked him, and he goes, we weren't taught that. I don't know anything about this system.
Endocannabinoid system, about the benefits,
yesterday,
anything.
He called me, and he says he has a patient that he wants to recommend. And I told him, he goes, do I have to write a prescription? I'm like, absolutely not. He's like, are you kidding me? Because he's been on it now for about 2 weeks.
Nice.
So he sees what it's been able to do for him, and he, it's important. So now he
recommend
feels comfortable.
CBD.
Yes, recommend CBD. And then he says, if this is not the step, because it was a 17-year-old child that's still a child or under a minor, he says, I will now start recommending cannabis because now I see and I feel what this possibly could do. So it's a start with CBD, with nutrition, vitamins in your naturally occurring endocannabinoid system. So as Dr. Uma says, start slow. And anything that you do, because you got to see how it's going to make you feel.
Yep.
Every individual is different. That's why the dosing conversation's so challenging. And people are like, oh, what's the dose? And it's like, we can't really tell you that. We want you to work with a physician, but it depends. It depends on what your pain is, what your ailment is, how much you weigh, your tolerance level. If you are already smoking cannabis, there's so many factors that contribute.
And I think education's key.
Education's key. And when we see these patients, I mean, in this conversation today, we've spoken about at least 4 patients that we are intimately involved in, and that's why we push hard.